Good morning. It's a pleasure to be here. So you heard so eloquently stated in the previous panel how challenging caregiving is, and specifically caregiving for patients with dementia. And that's my goal today, is to present to you a model funded by the CMMI Healthcare Innovation Project that we're doing at UCLA of providing better care for patients with dementia as well as their caregivers. I'm sort of preaching to the converted, excuse me, the converted here when I talk about the Great Plague, the Silver Tsunami, been called many different things about the onslaught of older Americans and bringing with them the diseases associated with aging, among them dementia. As you can see here, 5% of people with over the age of 65 to 74 have dementia. But when you are 85 years or older, up to half of people can have dementia. So it's a very common and very prevalent disease. About 5 million Americans have Alzheimer's, comparable to the number of Americans who have heart failure. And this number is only expected to go up. 15 million caregivers 50 million dementia caregivers provide 17 billion hours of care, worth $203 billion and $210. So they're a significant part of our economy, very important. 7 out of 10 persons with dementia are actually cared for by family members, mostly adult children and spouses and their friends. And yet most caregivers receive no counseling, training, or support to prepare them for this role, very important role. And as you heard from the panelists, caregiver experience poor health, higher risk of depression, and in fact, they've been shown to have higher risk of mortality compared to people who do not provide care. There's a lot of things that we can be proud of in our health system. Dementia care is not one of them, unfortunately. And pertinent to this discussion is that this study by the Brand Corporation and UCLA looking at the quality of care for patients with dementia, only 29% receive caregiver support. So it's definitely a quality problem. The UCLA Alzheimer's Dementia Care Program was funded by the CMMI to find a way to better care for patients with dementia. It's a co-management model in the sense that it is not meant to take over primary care, but instead partner with the primary physician or the specialist to better able to provide care for patients with this problem. It involves a needs assessment of the patient and the caregiver needs, developing and implementing individualized dementia care plans in partnership with the primary doctor as well as the specialist and the caregiver, and monitoring the response and revising these care plans as needed, and most importantly, providing access 24 hours a day, 365 days a year for dementia-related problems. The needs assessment involves a pre-visit questionnaire wherein the patient and the caregiver are asked about what their needs and where their resources are. And we perform a 90-minute in-person assessment by dementia care managers who are geriatric nurse practitioners with special training on dementia problems, as well as specialized knowledge of what community-based resources are out there for dementia. There's advanced care planning. We talked about financial and other resources that they may have or need. We discuss family concerns as well as community-based services and programs that may be pertinent. The output of this evaluation is a care plan. And it involves things like counseling and educational needs of the caregivers and the patient, linkages to the health system services, linkages to community-based services depending on which area they live. As you know, Los Angeles is a very large area and very diverse. Ongoing follow-up at intervals determined by their care plan, and usually follow-up can happen within 1 to 2 weeks after the initial visit. In terms of caregiver support, we have a Beyond Alzheimer's support group led by Patty Davis, who, as you know, is the daughter of President Ronald Reagan. We have resources in the UCTV video sites for caregivers. We sponsor these webinars called the Alzheimer's Caregiver Education Series, or the ACES webinar, wherein caregivers could view it online and submit the questions via Twitter. And we also have the Caregiver 101 resources, which is this lending library that we have for books, as well as DVDs and other resources. Improving caregiving for dementia, or the iCare project, is a 3-year project funded by the Archstone Foundation that specifically looks at providing tailored caregiver education and training, depending on several factors, such as whether they're paid or unpaid caregivers, what stage of dementia they are caring for, and these are some of the interventions that we have. Access is extremely important. Caregivers who feel that they don't have anyone to call for problems end up in the emergency room. So this is one of the things that we provide during office hours. They call their personal dementia care manager, who's very familiar with not only the medical but also the social needs of their patients. Nights and weekends, we provide them access to our geriatrics on call, staffed by our faculty geriatricians, and referral to specialists and primary care as needed. So where are we? So this is actually October data. Over 1,000 patients, actually 1,300 patients have been referred to this program within the UCLA system. We've completed the initial visit for over 1,000 patients. And there's many more that we are to see. Each of the dementia care managers have a panel of 250 patients. We've exceeded that. So we are originally funded for 4 dementia care managers through the CMMI grant. We have just hired our 5th dementia care manager, so just to respond to the demand. 165 unique physicians within our system have referred to this program. The mean age is over 80 and 66% female. Most of the patients have Alzheimer's disease, as expected. They have moderate to severe dementia with a mean mental state score of 17. So these are pretty impaired folks. And in terms of caregivers, 37% are spouses, 51% are children. This is baseline caregiver findings. As you can see here, 14% have depressive symptoms, 34% have high stress. And this is very important and interesting data that we found, that 77% of them felt that their regular doctor understands dementia and the challenges that they have. But only 20% of them knew how to access community services. 27% felt confident handling dementia problems. Only 34% knew where to turn to for answers. And 26% felt they have a healthcare professional who helps them work through their dementia issues. So there's definitely a disconnect there that is clearly seen. We provide caregiver training. We provide referrals to services such as the Alzheimer's Association Safe Return Program for wanderers, referral to community-based organizations, and referral to support groups. So from a caregiver satisfaction standpoint, 91% of them, this was a survey that was conducted after they've done their initial visit, 91% of them felt that the intake visit was time well spent. 93% felt that their concerns were listened to and addressed. And 70%, over half of them thought that referral programs were helpful. 74% thought the educational materials were helpful. And an overwhelming number felt that their caregiver role was supported and that they would recommend the program to other caregivers. As important as these quantitative data are, the qualitative data are equally important, and you can read some of them here. Physicians are happy with the program. They felt that we are providing valuable medical and behavioral recommendations. They felt that having their patient come to a program actually enhanced their relationship with their patients, and they saved them time, and they would recommend it to patient. Overall quality for dementia care for patients enrolled in this program exceeded patients who were not enrolled in this program. In terms of patient outcomes, as expected, as you know, dementia is a progressive, incurable disease. And so in terms of the mini mental state examination, a year later, obviously they have declined. The red is is at baseline, and the green is after a year. But in terms of functional status, as you can see here, the functional status where higher is worse, it also worsened. However, depression of the patients actually decreased, and behavioral symptoms actually decreased through enrollment in this program. How about the caregivers? Well, the caregivers experience, they felt that they know how to access community services. They're more confident in handling dementia-related problems, know where to turn to get answers, and have a healthcare professional who helps them. Caregiver strain had decreased, although that's not significant. They did have a decreased caregiver depression, and most importantly, they were less stressed when behavioral problems appear in these patients with moderate to severe dementia. So the future of the program, we reached this. Our goal with the CMMI project is to see 1,000 patients. We've exceeded that. We're sustaining our challenges are to sustain the program after the CMMI funding ends this summer. And we're very interested in spreading this program beyond UCLA. So just in conclusion, these are the lessons we've learned thus far. Dementia caregivers feel that they're ill-equipped to handle dementia-related problems and accessing disease-specific information and community-based services. The provision of comprehensive dementia care management can actually lower caregiver distress and depression, even as the disease progresses and the function goes down. And care management and caregiver support leads to improved quality. We know that from our experience. But the question is whether we lower cost, and that's still a question because we are waiting for our data on utilization. Thank you very much for your attention.